In this 10-minute medication math episode, we talk about double-checking your dosing. If you're a paramedic transporting a patient from a facility, you might be double-checking the nurse who is sending the patient. If you're a nurse, you might be double-checking the doctor or your charting software to make sure the dosing is correct. Most importantly, I hope you're double-checking yourself.
If you're transporting a patient with a medication infusion, who did the math? Was it the nurse who is sending the patient? Did the IV pump do the math? Do you carry an app on your phone?
If the nurse did the math, it's likely that they used charting software or an IV pump to calculate the infusion rate. Your pump might also have the ability to do the calculations, like calc mode. There are also many apps that you can download to your phone to help you do the math. This one is called Super Infusion Calculator, for example. I like it, but it's not a sponsor, and you should do your own research to find an app that works for you.
Double-checking math is more than just a way to keep your skills sharp. Mistakes do happen, more often than you might think. It's a patient safety issue. Here are 2 cases in which the sending facility made mistakes, or didn't truly understand the orders. Judge for yourself if you would have caught the error, and if you have the skills to fix the problem when everything else failed. This first case is a patient in heart failure resulting in pulmonary hypertension being transferred to a higher level of care. The doctor ordered an infusion of milrinone. Milrinone is a drug in the same category as Viagra or Cialis and is for pulmonary hypertension. During the transfer of care report, the nurse states that the dose is 0.2517 micrograms per kilogram per minute. The critical care paramedic thinks this dose sounds unusual because most drugs are not dosed to the 10,000th place. The hospital pump is infusing at a rate of 5.3 milliliters per hour. The patient weighs 72.4 kilograms. The critical care paramedic pulls out his handy reference card and double-checks the math. The formula is micrograms per kilogram per minute, so we enter 0.2517 times 72.4 kilograms times 60 minutes. The 60 is to convert minutes into hours, because IV infusions are usually measured by the hour. The concentration is 200 micrograms per milliliter. You can press pause here to do your own math if you want. If you did the math yourself, you'll see that the milliliters per hour equals 5.47. The paramedic on this call adjusted the transport pump to 5.47 in order to give the correct dose as ordered. When the patient arrived at the destination ICU, the receiving nurse was not familiar with milrinone and needed additional information. The critical care paramedic explained what milrinone is and how it was dosed. While both were looking at the hospital's computer, the paramedic noticed that the charting software listed the dose as 0.25 micrograms per kilogram per minute, or 17 micrograms per minute, not 0.2517. The first dose is weight-based, the second is not. No harm was done, because the excess amount was only 0.0017 micrograms more than what was actually ordered. But it does show that double-checking is an important safety step, because errors do happen.
In the second example, harm was done to the patient prior to the arrival of the ambulance. Fortunately, the paramedic noticed the problem and fixed it soon after arriving. In this case, an adult male suffered cardiac arrest and was resuscitated. He was intubated, but he kept reaching for his airway and trying to remove medical equipment. The hospital placed him on a propofol infusion to sedate him because they wanted to keep his airway protected. When the ambulance arrived, the critical care paramedic took a report from the nurse, who told him that the patient was receiving 25 micrograms per kilogram per minute of propofol. During the report, the doctor stopped by the room and gave an order to the paramedic that if the patient starts moving again, just give him some more rocuronium. This order sounded inappropriate, because the most likely problem was that the sedation wasn't working well enough. If the patient isn't fully sedated and you give rocuronium to paralyze him, that would be cruel. The paramedic decided to double-check the dosing. The formula for micrograms per kilogram per minute is on the reference card he carries. The patient weighed 105 kilograms. The paramedic looked at the propofol, and the concentration was 10 milligrams per milliliter. Since the dosing is expressed in micrograms and 1 milligram is 1,000 micrograms, this means the concentration was 10,000 micrograms per milliliter. When the rate is calculated, the answer should be 15.75 milliliters per hour. But when the paramedic looked at the hospital's pump, the rate was set to 1.5 milliliters per hour. The paramedic also noticed that the name of the medication did not appear in the window where it normally would, and he immediately knew what happened. When the nurse programmed the pump, she used calculation mode to enter the data. When asked what the concentration was, she entered 100 milligrams per milliliter instead of 10 milligrams per milliliter. That caused the pump to give 1/10 the desired dose, and the patient wasn't being sedated enough or at all. Rather than pushing rocuronium, the paramedics simply increased the dose to the appropriate rate, and the problem was solved.
So you see, practicing medication math isn't just about making EMTs and paramedics and nurses learn the old-fashioned way, and it isn't about trying to get providers not to use the calculation tools that are available. Understanding and being comfortable with medication math is an important way for providers to be able to spot problems and fix them. It doesn't hurt that if all your devices fail, you can still calculate an appropriate drip rate for your patient. But that's only one reason to practice your medication math. Thank you for watching this video, and I hope to see you on the next one.